Hi everyone, it's Kelly from Proactive Pelvic Health Center. Today we're here to talk about running. So with running, a lot of times people can experience things like pelvic pain or stress incontinence, in which case, if you do experience those things, that's an indication that you're going to want to come in and just chat with us and maybe get a pelvic floor assessment done. So when we run, we create a lot of ground reaction forces and up and down forces, and that can also trigger some of those stress incontinence symptoms. And so this is a really great strategy you can use just to kind of check out your running technique and just make sure that you're running in a way that's A, efficient, and B, just minimizing some of those up and down forces on your pelvic floor. So when most people run, they often tend to bounce up and down a lot, and you'll see people that are really just upright and they're running and they're going bouncing up and down like that. And so what that looks like is it's this. And so when you're running like that, you're getting A, gravity, you're getting the force of your foot hitting the ground, and you're getting an opposite and equal reaction force from the ground up. And so in plain and simple terms, that's a lot of force. Okay, and if your bladder is bouncing up and down and your pelvic floor muscles are just a little bit weak, or they're not coordinated, or they get tired really easily, then that's when some of those symptoms can arise. And so what we can do is we can play around with your technique about running. And so if we take this angle and we change it to this angle, then we actually get less force on the body and on the pelvic floor, and hopefully you're getting less of those stress incontinence symptoms.